I also highlight the fact that we've recently done some work showing that and developed a molecular diagnostic tool to assist in the classification of pigmented tumours, and we've been able to demonstrate that this tool is useful in diagnosing nevoid melanomas. So that was that particular lesion. The second type of melanoma that's prone to be not recognised is desmoplastic melanoma. And these can be incredibly subtle lesions, both clinically and pathologically. So clinically, they often present just ill-defined thickening of the skin. They typically occur in chronically sun-damaged skin of elderly patients, most commonly on the head and neck region, but can occur anywhere. They're important to recognise for two reasons. Is first of all that they're prone to be underdiagnosed or misdiagnosed, and secondly because they behave in a different fashion compared to conventional type melanoma. So compared to conventional type melanoma, they tend to occur in a slightly older group of patients, as I mentioned, often in the head and neck region. They behave more like a sarcoma than a melanoma. And by that I mean they tend to metastasize to the lungs rather than regional node fields. And because they typically occur in chronically sun-damaged skin of elderly patients, they have typically have a very high tumour mutation burden. And we know that increased numbers of mutations within a tumour is associated with increased numbers of expression of neoantigens on the surface. And immunotherapy is effective because it unmasks or unblocks the inactivation of the immune response against the tumour, and as such, desmoplastic melanoma, with its high expression of neoantigens, responds incredibly well to immunotherapy. So it responds better than other subtypes of melanoma. So there are clinical features that are important about desmoplastic melanoma. Another one is that it is prone to exhibit neurotropism, so it has an attraction towards nerves and can present with symptoms related to this, so paresthesia or numbness, sometimes tingling. Histologically can be very subtle. When looking down the microscope, you may just see some thickening of the dermis with some very subtle increased cellularity. It's often associated with severe sun damage, and there's often some lymphocytes in the associated dermis, which can be a clue to diagnosis. So I think that's a pot summary of desmoplastic melanoma, why it's important to recognise, and the characteristic histological features that can assist pathologists in making the diagnosis.